Namaste and good morning. This is my pleasure to be here in the TEDxKathmanduUniversity chapter. And basically I'm a medical doctor working in the heart health, cardiology. So I'm going to talk briefly about what is the heart health for all. It's not only the one age group, but all of the age group from the starting to the old age. And 32 years old lady working in the field suddenly had a chest pain. It's a chest discomfort. Basically, what we think is whenever we have a discomfort, it may comes and goes. So she thought the same, it will go. And she was working in the field, and it was a little bit discomfort. She took a rest, but not gone away. It is increasing, so then she stopped working and went back to home and took some warm water and some rest, but it didn't go. Obviously, whenever we have a problem, what we do is taking some local remedies, sort of a food, sort of a something others. So she took the same, but it didn't go away. That night went, but in the middle of the night, she had a severe pain. It is increasing. So she went to the local nearby, the medical shop, and took advice and some medications, but even it didn't relieve. So then after, she went to the primary health care center, and there it was taken an electrocardiogram, and suddenly she was told that you had heart attack. So heart attack means, we often say this is the very dangerous, very severe, and it may take your life away. So heart attack is obviously the very dangerous. And she was really afraid, and her family, her husband was afraid. So whenever there is a terminology like heart attack, the treatment is also quite advanced, quite expensive, quite unaffordable. So many things comes to the mind. So they were a little afraid, but still, what to do? It has to be taken care. So then she was referred to our hospital, Dhulikhel Hospital. This is located out of Kathmandu capital city in Nepal. It's 30 kilometers away, but it is catering the many of the people from the remote areas. So she was brought into our emergency, and then we immediately shifted to cath lab, and we performed the angiogram, because whenever there is a heart attack means there must be one coronary artery maybe occluded or blocked. So that has to be immediately open it up. Otherwise, there will be the more damage of the heart. So we took her into the cath lab. Our team started our treatment, and we found like this. Yeah. How can it back? Is there any back? Yeah. So you can see there is a artery is blocked, and we open it up. We open it up immediately. The video is not played, I'm so sorry for that. So it was open it up. Then we shifted to the ward, and I talked with her. She was a lady from village, working in the field, not economically well off. And she could not take any sort of advanced medications even, but she had this problem which could be taken care by us. But she had to take care of lifelong medications and lifestyle modifications. Otherwise, she may have the problem in future as well. So what we need to know is how to prevent those sort of things. In the meantime, how to take care of all of them. So that is right now my work. How I serve those people who are having the heart diseases. That's my background. Back in my past, while I was about 20 years of age. So something about 40 years ago. So I was in my early career, I used to work in the very remote area of Nepal, that is in the Baglung district. I used to see children in the maternal and child health clinic. And those who were suffering from the diarrhea, dysentery, malnutrition, tuberculosis, pneumonia, those all communicable diseases. And I had to treat them. In the meantime, I had to go to the villages to train the community health workers, the teachers, the family members, Tami Jakri, how to take care of the simple ailments, simple disease, how to prevent and how to treat. So those are my days in the past. After 2 years of working in a very remote area, I understood what is the geography of a country, what is the socio-economic conditions of the people, what is the educational status of the people, how much they are suffering from. So that is understanding, and that's not like a reading, that's I felt, I practiced, I grew up with them that 2 years. So that embedded into my mind in a way like, if I work, I will have to work for those people who have less accessibility and affordability to the health. That's how I landed up in the Dhulikhel Hospital today. And after this, my past, this is in the same sort of a villages. This is very beautiful village to see if we have to live over there, and that's a very hard life. Not only from the point of view of transportations, educations or something else, but also hardship of life is totally different. We may romanticize the location, but practicality is very, very challenging. So from there, I returned back to Dhulikhel Hospital, and I always feel like I have to work for those people who have no accessibility to better care in the urban city. That's why I used to go to the, again, villages to look after the children or as well as the adult people who may have the problem of health. So we used to go to the school children to screen their either congenital heart disease or rheumatic heart disease. Then back in my office or in my hospital, Dhulikhel Hospital where I work, there I used to see the patients in my outpatient service as well as in the ward and in the cath lab working. So what is heart health? Can you play the video? Is this, it's not autoplayed, I'm sorry. I'm sorry for this. If it is not played, let it be. It will take more time. So then I started how to aware the people. What is the cause of our coronary artery disease or the heart attack? And it is basically the coronary artery over there. And that coronary artery may be blocked because of our lifestyles. What are the lifestyles are if we smoke, if we eat unhealthy diets, if we don't exercise, if we are obese, if we are more stressful, if we snore a lot in the middle of the night, all these are the risk factors. Of course, there are other risk factors like genetics. If our mother and father or ancestors are having the heart disease, we may acquire the same heart disease, but that we cannot change at all. If we are aging, we may have the heart attack, but we cannot change that all. If I am a male, we are a male people, more riskier of having the heart disease, but we cannot change. But change the, which can be changed, lifestyles, those we have to take care. For that, I used to work a lot for awareing the people, how we can keep ourselves healthy to prevent the heart attack. If you see the data, in Nepal, we have a group of people studied, and our trends of the cardiovascular disease is increasing. From 1990 to 2017, it is increasing. Our lifespan is increasing. In the meantime, we are also having a risk of having the heart attacks anytime. So that is also increasing. If you see another graph, our disability adjusted life years is also getting lost. So this is also increasing. More and more people are disabled because of the heart attack, and also mortality is also increasing. So that's why we have to be very, very careful about our life. If you see the graph again, you can see nowadays there are a lot of food available, healthy or unhealthy, and our children are preferring unhealthy food. So that unhealthy food, lack of exercises are increasing the obesity. At the age of 20, we are increasing the obesity, and obviously it will increase into the many of the diseases, insulin resistance diseases like diabetes, hypertension, heart attack, stroke, and so many of other diseases are increasing because of our lifestyle. So that is a very important fact we have to understand. Our children are now very much of enjoying the laptop, videos, mobile and all. Along with that, all this junk food. What is junk food? Sometimes it is difficult to define what is junk food. Ready-made food. Ready-made is to make easy either to cook or to ready-made food eating in your workplace. But is it good? Because it is preserved in a way that adding something which preserves the food from organisms which may that spoil the food. So to block from the organisms, there must be some either chemicals or natural preservatives. Those preservatives are not good for the health at all. Along with that, lot of sugar, lot of salt, lot of oils. So all these things makes you unhealthy. So those are the reasons why obesity is increasing, why the risk of the heart attacks and strokes are increasing. And to get rid of this, we have to aware people and we have to modify our lifestyles. There is no other way. So what are the lifestyle modifications? We may be knowing, everyone is knowing, but not practicing. It is very difficult to practice. It is easy to say. I do talk, sometimes I do also enjoy this sort of a food, but I have to be aware every morning that no, I should practice healthy lifestyle. Walk, don't eat junks, eat healthy, and try to get sleep, good sleep, stress-free. All these things are very important. So these are the important weight reductions. Yes, of course, sometimes this is challenging. Some people are not getting the weight reductions. But at least you have to be mobile. You have to be very much of a fit, in a way, doing the exercises. And we have to modify our lifestyle in a way that we should keep ourselves healthy. Don't smoke. That's the most important part. Exercise daily. Don't eat junks. And try to eat very healthy. Those things are very, very important to keep ourselves healthy. So that is my life, how I have to aware my people in a way so that their health is healthy and their lifestyle is not acquiring those sort of heart attacks or stroke immaturely. Of course, maybe after 70, 80 years, we may have some problem, I may die, that we all know, but not at all at the age of 30s, 40s, 50s, 60s, this immature death, we can prevent with our own modifications of the lifestyles. That's what I'm doing, not only treating. And where I'm working, this hospital is basically there to support those people who need us, who are less accessible to health care, as well as the affordability to the health care. For that, we are working. With this, my short, brief introductions of my work, I will end up here, and I hope this will amply change our lifestyles and this makes us some sort of a healthy life in a way. Thank you very much.